Hi, it's Dr. Janowski for Sonata Aesthetics. Today I want to talk about fat and fat removal. As we are aware, there are many devices out on the market now that claim to remove fat or kill fat or freeze fat or heat it up non-invasively. And everybody's excited about this because they think that they can avoid liposuction or actually removing the fat and still get great results. Some people can, but after looking at a lot of these technologies and listening to patients, cool sculpting, Sculpture, Ultra Shape, there's lots of them on the market. There's a lot of disappointed people, and the reason is because we're trying to do something internal to the body by somehow passing energy through the skin or freezing the skin and then causing the effect from outside the body, when we know that the best way to body contour or body sculpt someone is to actually remove the fat. And so that's what liposuction does, and it's been around for close to 40 years now, and it's not what people think it is. And so I want to talk about myths and realities when it comes to liposuction, because it's still the best way to body contour, and it's also quite safe, and people have a lot of misconceptions about it. So number one, liposuction is an operation done in an operating room under general anesthesia. Wrong. Liposuction is an office procedure done under local anesthesia with mild sedation. This is much safer. It's really become an office procedure, and it does not require being in a hospital. And because we do it this way, recovery is much easier, and it's a much safer procedure than it used to be. And that's what they used to do. They used to put people under general anesthesia, and that's where all the problems came. Number two, liposuction is painful. We're going to numb the entire area. This is something that is not done with non-invasive contouring procedures. We numb the entire area locally with what's called a tumescent solution that's made of lidocaine, a little bit of epinephrine, and some bicarbonate. And this makes the entire area completely numb. You don't feel anything after that's put in, and putting it in is not difficult either. It just feels like a fluid being pushed in there. Liposuction has a long recovery. It used to, not anymore. We're talking about a few days of soreness, staying off your usual exercise regimen. Bruising is possible, a little bit of swelling is possible. But most people at a week out are feeling fantastic and are starting to get back into their normal exercise routine. So it really just takes a few days, and it's not a difficult or painful recovery. Liposuction is dangerous. Again, it used to be somewhat risky. Now we've eliminated a lot of these risks. The risks used to come from general anesthesia, removing too much fat or being too aggressive, which was more of a surgical technique, and things like IV fluids, IV medications. These all have been eliminated. There's no need for any of that. It's again a very safe, locally done procedure, and typically, if someone has many areas that they want treated, we will split that up into several treatments. That makes it safer, and also recovery will be easier. So we're going to roll out a series of videos showing you just how easy this is, and why I feel, after trying both invasive and non-invasive methods, that liposuction is still the best method, safest, best method, and best results, happiest patients when it comes to body contouring. So stay tuned for that.